Thyroid cancer typically presents as a thyroid nodule found by patient or during imaging studies of the neck. The diagnosis of this nodule requires inserting a small needle, a thin needle into the nodule to collect cells for microscopic examination. This procedure is called fine needle aspiration biopsy. And in most cases, this procedure allows us to say if this nodule is benign or malignant. However, in about 1/4 of all nodules, this procedure cannot yield a definitive diagnosis, and these nodules are called indeterminate. Recently, we developed a new diagnostic test that we called Thyroid. This test was developed based on the discoveries of new genetic markers in thyroid cancer made in my laboratory here at the University of Pittsburgh and in many other labs around the country and in the world, and using a revolutionary technology that is called next-generation sequencing that is recently become available for us to use in the clinical lab to look at the genetic profiles of very large number of genes in human DNA. Patients will benefit from Thyroid in several ways. Specifically, when the nodule is found to be indeterminate by microscopic cytologic diagnosis, typically these patients undergo a diagnostic lobectomy. One lobe of the thyroid is removed to basically establish the diagnosis. And if the diagnosis of cancer is established in these nodules, patients have to have second surgery to complete thyroidectomy. So this is a suboptimal two-step surgery. If the nodule found benign, this surgery was unnecessary in the first place. By using Thyroid, we can accurately diagnose this nodule as benign or malignant, and therefore either to recommend the upfront total thyroidectomy, which will avoid two-step surgery, or recommend just observation and no surgical approach at all for these patients. Until recently, next-generation sequencing, this very powerful new technology, has been used only in large tumor samples, and it has never been used in a very small number of cells that can be collected by a thin needle from the nodule. We, for the first time, validate the use of next-generation sequencing specifically for thyroid nodules and thyroid cancer, and demonstrate that even very few cells collected from the nodule will allow us to provide very reliable diagnosis of benign or malignant process in a given thyroid nodule. Physicians need to know that this new diagnostic tool is available. They can take advantage of this new tool in order to provide a very precise diagnosis and optimize the surgical or conservative management of these patients.